let's really think about that for a second. What are they trying to say? Well, the argument is that if healthcare were somehow quote-unquote free, like the police department is and the fire department and the library, that people would overuse it. That they would go to the doctor for every time they sneeze. They would run to the doctor as hypochondriacs, and the system would be overloaded. Now, does that really make sense? Now, as a citizen, don't you feel just a little bit insulted when they tell you that? That they're not saying that, oh, well, there's one or two people, but it's not really an issue. They're saying that the majority simply can't be trusted to make healthcare choices. That the majority are hypochondriac. The majority would run to the doctors. I just can't comprehend how insulting that is to me personally as a citizen, and I'm sure to you too, to hear that you're simply too stupid to understand when you need to go to the doctor. That if you sneeze, you were instantly running to the doctor and demanding MRIs. Well, this is ridiculous. And I can't even really talk about that. It's just so insulting and so ridiculous. I'm not going to discuss it. Because I trust my citizens. I trust my fellow citizens to make correct choices. I know when I need to go to the doctor. I'm not going to go to the doctor every time I blow my nose or every time I stub my toe. I'm not running to the doctor. Nobody likes sitting in a doctor's office. The DMV is quote-unquote free too, but nobody really goes down there because they're bored. The police department's quote-unquote free, paid for by taxes, but nobody really gets bored and starts calling up the police because they have nothing better to do or because they heard a noise in the basement. People use these services. The majority, the overwhelming majority, use these services responsibly. And to suggest that somehow with healthcare it would just be overrun is ridiculous. And it doesn't give the doctors and hospitals enough credit either. They know how to deal with hypochondriacs. They know when somebody is not a priority, and they can prioritize it. The idea that the hospitals would be treating somebody with a runny nose and forcing a heart attack patient to wait in the waiting room is insulting to the doctors and hospitals too. And let's just move on because we can all agree that that's a ridiculous statement. Now, the other one is healthcare would be totally controlled by government bureaucrats. Well, this is just ridiculous. No, it wouldn't. All universal healthcare does is change who gets the bill. Instead of the doctor or the hospital sending individual patients bills for $200,000, they would instead be billing the government, and the government would pay the bill. It's kind of like how the military is paid for by the government, the police department is paid for by the government, the fire department is paid for by the government, the libraries are paid for by the government, road repairs are paid for by the government. There really isn't a lot of bureaucracy. It's just who gets the bill. So the government isn't denying health care. The government isn't telling doctors what to do. And there's really no evidence of that. But it is an effective scare tactic. It does scare people. But let's be realistic here. Who does deny coverage? Who does tell doctors they can't practice medicine? The current insurance system that we have in place. Now, there's been many times in my family's history and friends at work where it's just horror story after horror story of they need something done. The doctor says, look, I want to run this test just to verify what's going on. And the insurance company will say, no, we're not paying for it. Now, the problem is that the tests are so expensive and the procedures are so expensive that the individual person can't pay for it. So they are denying coverage right now. And conservatives refuse to acknowledge it. I just want to look at the conservative in the eye right now and say, just come clean. Just admit that the real bureaucracy that's costing people's lives and denying treatment right now is the current third-party insurance system. We have this third-party intermediary. When a doctor tells a patient, I want to run this test, I think you need this procedure, that should be good enough. Why is the insurance companies saying no? Where do they come in saying no and denying treatment? Now, when you can't afford a treatment and you don't pay for it, that is denying treatment. They can say, well, we're not denying treatment, we're just denying payment. Let's just stop playing games. That's denying treatment. And I want the conservatives to just come forward, fess up, and admit that that's exactly what happened. They're sitting here saying, oh, the government's going to control everything. The government's going to control everything. We as citizens can't even choose our own doctors because who chooses our doctors for us? Blue Cross and Blue Shield does. I want to go to this doctor across the street. I've known him my whole life. He's within walking distance. That's where I want to go. Oh, he's not in network, so we're not going to pay for that. Now, this theory that the government is going to limit your choice is not true. But what blows my mind is that's exactly what's happening now. Blue Cross Blue Shield is telling you what doctor you can go to. It's denying you the surgeries that you need. It's all happening, and conservatives are saying, well, we're afraid this is going to happen. Afraid. If we go to universal healthcare, they're afraid the government's going to deny coverage. They're afraid the government's going to tell you what doctor to go to. That is happening right now. That's what insurance companies do. Insurance companies don't let you go to whatever doctor you want to go to. And the conservatives know that. Because the insurance companies won't pay for every single procedure a doctor recommends is necessary. And the conservatives know that. And we're all just playing games by pretending that the government bureaucracy is going to work. It doesn't. The government doesn't really care. They just pay the bills. Now, they might investigate doctors from time to time if there's outrageous problems or there's gross malfeasance or the fees are way out of whack with what's normal and customary. Yeah, that's good and that's normal. But the idea that there's some wholesale going to just deny surgeries because that's the only... because they can't afford it, or I'm not even sure what the conservatives are even arguing. Why would the government deny anything? I mean, look at the military. When has the government ever said no to the Department of Defense? No matter what they ask for, it's a blank check. And I don't even want to get into that. But basically, yeah, that whole fear that the government is going to control your life, it's ridiculous. Actually, the exact opposite is going to happen. You're going to have freedom now. Because whereas the insurance companies were saying, you can't go to this doctor, you can't have this surgery, under a universal system, you can go to whatever doctor you want because the doctor is getting paid by the government. And the government doesn't care what doctor you go to. And if a doctor recommends a surgery and it's usual and customary for, your situation, like if you had a heart attack and the doctor does heart surgery, well, that gets reimbursed. If you have a heart attack and the doctor instead does a breast augmentation, yeah, the government might investigate that and see what's really going on. And that's a good thing. But this idea that you're going to be controlled and your choices will be limited is just ridiculous. In fact, just the opposite is going to happen. And I want to stress that. The opposite will happen. You will have more choices. You will go to whatever doctor you want instead of the one the insurance company tells you to go to, or, orders you to go to. And you'll get whatever surgery the doctor recommends.
Looks like I ran out of time, but to hear the rest of the conservative myths regarding universal healthcare debunked, check out the comment section below.
Health savings accounts. Now this is going to be brief because I just don't understand the logic of saving up for an illness that you may or may not get. I mean, what is the point here? The whole thing is, oh, well, it's tax-free money. That money doesn't get taxed. Yeah, so what? I have a $500,000 chemo bill, and I'm saving, $200 a month in this health savings account. What good is that doing anybody? How is that really helping? Now, the conservatives are selling us on the idea of, well, you get to keep it. That's your money. You can do whatever you want with it. If you don't spend it on healthcare, you can spend it on other things. But again, it's worthless because the real problem here is that most procedures are so expensive that the average American can't pay for them. The average American can't pay for quadruple bypass surgery. They really can't afford a lot of the stuff. I mean, if it's serious cancer, you're not going to be able to pay for that out of pocket because we're talking hundreds of thousands of dollars. So the idea that you're somehow going to save up hundreds of thousands of dollars, I don't understand the logic in that. It's just ridiculous.